Namaste everyone, I am Dr. Amit here. Hope you all are doing well. Welcome back to my YouTube channel at the rate Dr. Amit Official. So it's a place for easy and effective medical learning. So if you haven't subscribed it, make sure to hit the subscribe button and stay tuned for more valuable content. So in our last video from microbiology series, we talked about an important gram-positive bacteria, Listeria monocytogenes. Now, moving ahead in our microbiology series, today we'll discuss about an important clinical gram-positive bacteria, Nocardia and versus Actinomyces. We'll see the difference between Nocardia and Actinomyces in this video, and it's very important topic. Uh, so that examiner will not confuse you in different entrance exam or MBBS professional exams or USMLE steps. So let's dive in and get started with our topic, Nocardia and Actinomyces. And this is last from our gram-positive bacteria. We have discussed almost all the important gram-positive bacteria. Now today's last, that is Nocardia versus Actinomyces. Okay, so let's start our today's lecture, Nocardia versus Actinomyces. Okay, so while talking about the lab feature, okay, so talking about the lab feature of this bacteria, both are gram-positive. Okay, Nocardia and Actinomyces both are gram-positive, and filamentous, or we can say that it's a branching bacteria. Okay, now both are gram positive, both are filamentous and branching bacteria. So how to differentiate between these two bacteria? Okay, so we'll see the differentiating line between these two bacteria. Okay, so Nocardia is aerobic. Okay, it's grow in the presence of oxygen, and this Actinomyces is anaerobic. Okay, so anaerobic. Okay, now while talking about this Nocardia, so this Nocardia is acid fast, okay, weak acid fast, and this is not acid fast. Okay, so while talking about acid fast organism means are bacteria that resist decolorizations, okay, by acid alcohol after being stained. Okay, so when we do staining, okay, especially with Zeren staining, that is Zell-Nelson staining, so the decolorization by acid alcohol is resist, okay, by this bacteria. So that's why they are called as acid fast bacteria. Okay, so this Nocardia is a weak acid fast and Actinomyces is not acid fast. Okay, now where it is found? So Nocardia is found in soil, and this Actinomyces is a normal flora of oral, okay, reproductive and GI tract. Okay, now how we get infections from Nocardia? So after inhalation, okay, so by with the help of inhalation, this Nocardia causes infections, and this Actinomyces actually enters in our body by mucosal breaths. Okay, there will be mucosal breaths. Okay, now what does this Nocardia causes? Okay, so this Nocardia especially affect our lungs and brain. Okay, in lungs it causes pulmonary infections in immunocompromised. Okay, and this Nocardia infections mimic as tuberculosis, but it will give negative PPD. Okay, PPD test will be negative. Okay, then it also causes cutaneous infections after trauma in immunocompetent patient. Okay, in immunocompromised it causes infections that mimic TB, but in immunocompetent it causes cutaneous infections, that is skin infections. Okay, and it also is spread to CNS. Okay, in CNS it causes cerebral abscess. Okay, so we can talk three. Okay, lung infections, skin infections, that's cutaneous, and one brain caused by this Nocardia. While talking about this Actinomyces, okay, it's a normal flora of oral, reproductive, and GI tract. Okay, so after mucosal breach, it causes oral or facial abscess. Okay, and that abscess will drain through sinus tract. Okay, then it can also causes dental to our teeth. Okay, dental caries, then maxillofacial trauma. Okay, and sometimes it also causes pelvic inflammatory disease. Okay, with the devices, the intrauterine devices we use, so it causes pelvic inflammatory disease in those females. Okay, then always remember this buzzword, that yellow sulfur granules. Okay, so this yellow sulfur granules is a buzzword for Actinomyces. Okay, now we'll come to treatment part. Okay, so while talking about treatment part, we treat Nocardia infections with the help of sulfonamides, that is trimethoprim sulfamethoxazole. Okay, and to treat this Actinomyces, we treat these infections, infection of Actinomyces with penicillin. Okay, so we can remember with this mnemonic SNAP. Okay, This S for sulfonamides and for nocardia. Okay, so SN for we'd give sulfonamides in nocardia, and AP, that actinomyces with penicillin. Okay, so remember this buzzword SNAP. Okay, so this is all about the key differences between nocardia and actinomyces. Okay, as they both are gram positive and filamentous, so it's important to remember these differentiating points between these two. Okay, so this is all about nocardia and actinomyces, and this finishes our important gram positive bacteria series from the microbiology. Okay, now we'll move ahead to gram negative fungi and viruses. Okay, mycobacteria in our further video from the microbiology series. So if you like this video, please do like and subscribe to my YouTube channel at the Dr. Amit Official. We'll again meet in the next important conceptual video from our MBBS subject. So till then, stay connected, keep work harding, and we'll meet in next video. Thank you.